Welcome to another episode of Health Matters here on KFUG Community Radio. We have PA Lynn Szabo here, and you have a very special guest with us today.
Oh, yeah, he's super. And this took a while to get it set up, so I'm so thankful that he's here today and able to talk to us. So this is Doctor Madison MacGregor, who is a PhD in physical therapy and has actually been helping me with my ankle issues post-operatively. So, but there's a twist to his care. And I'll go ahead and introduce you, Dr. MacGregor, and then can you tell us what it is you do?
Yes, thank you for having me on. I'm very excited about this. I love to talk about the field. Yeah. My little twist is I am now all virtual, so I do all telehealth or tele-PT, as it may be discussed in some circles. And it's a totally different way of doing things, mostly brought on by the need after COVID and, getting the shutdown everywhere. People needed care and people were not wanting to come into clinics. So that's kind of what it was born out of. And then it's taken off from there, or at least that's the hope. We're trying to move it that way.
Yeah, kind of the rise of Zoom, I imagine, was part of the thing that makes this so successful.
Yes, that was definitely a big help. And technology coming further too, to being able to do more virtual care as well.
Yeah, so my involvement with you then, I would say the day before I met you, I was about 4 months out of surgery. I was in more pain than I'd ever been in. And, I was trying to get back into my practice and seeing my patients. And then, I kind of had a meltdown thinking that this was just my new normal and it wasn't a normal I wanted. And it was the very next day we had our first session. I found it really personable. Somebody I could really talk to, somebody who has listened to my, medical story here. And then we were off and running. You were kind of watching over Zoom to see what it is that I was able to do, and then kind of giving me suggestions for exercises. And mostly, I think the visit was an hour long. It seemed like it flew by faster. And then you would give me, do this exercise and do that exercise, and then modified it to what I needed. And my pain level just dropped off to nothing, really. I was super impressed. So
I appreciate that.
What kind of things, I know what I refer people to for, and pain's a big part of this, but what kind of things can you help somebody with Zoom PT?
Good question. I would say, generally speaking, there's always going to be a certain amount of people, no matter the diagnosis, no matter lifespan where they're at, that are not appropriate for virtual care for one reason or another. But outside of that, I would say you can really do almost everything you can do in the clinic, in a hands-on, in-person physical therapy clinic. You can take that and you can do that to at least some degree virtually. Now, that may be seeing somebody initially when they're less mobile and don't need certain hands-on techniques based on their clinical presentation.
Right.
Or it may be seeing somebody a little bit later after they've done that in-person portion, and then taking their care from there when they're moving around more and have more availability to be appropriate for virtual care. But I always describe it as in person, I would say anybody that walks in the clinic. I would see lifespan from babies all the way up to centenarians and everybody in between, and all sorts of mixes of body parts, different styles of PT, orthopedic, sports, neuro, cardiovascular. And so for, generally speaking, I would say that's still the bulk of my practice. Mm-hmm. The population that I work with tends to be more of 50 plus, but that also goes in waves. So I will have more of that population, and then it'll shift to a younger population, and there's usually a sprinkling in between there. I usually have some teenagers or preteens, And then I usually have up to in the late 80s and 90s. And we're talking about hips, knees, ankles, elbows, neck injuries, low back, Parkinson's disease, cerebral palsy, you name it. And then I do have pelvic floor patients and vestibular rehabilitation. So vertigo, that sort of thing.
Oh, okay. That's a new one for me. But pelvic floor dysfunction is a hard one to get physical therapy for because, well, number one, physical therapy isn't really a thing that Del Norte offers, and number two, that's kind of a new specialty, isn't it? You said it was your passion at one time.
It is a passion of mine, yes.
Uh-huh.
It is relatively new in the grand scheme of physical therapy. I would say there's been a huge push. Actually, also in COVID, there was this beautiful surge of pelvic floor PTs getting very active on social media, getting very active in advocating through different professional organizations like in our own, and also advocating to, the PA's professional association and chiropractors associations and, medical doctors associations. So it's relatively young, and I will say that always goes back to really underfunding and intentionally excluding women from the conversation, because a vast majority of pelvic health is done on women, whether that is just assigned female at birth and then they identify as something else later, or if they carry that label through their lives. Everybody does have a pelvic floor though, so there's all sorts of gender and sex spectrum identities that are represented in pelvic floor and can benefit from pelvic floor. But yes, it is more of a new up and coming specialty within the field, I would say.
And also, actually, I have a lot of men in my practice who, people who identify as men and men from birth, who it's just such a topic of shame for everybody. And
Yes.
to be able to talk about it, and not only that, but give somebody an option, a way to
Yes.
to solve the problem. Something in the case of women with a vagina, not doing something besides Kegels. And we've talked
Yes.
about urinary incontinence, and you have to do hundreds of Kegels, and I think it's kind of a cruel hoax myself. But I just appreciate that you have that expertise. And you're not the only one doing tele-PT. Do you know of other people? Like, what other resources might we have in Del Norte, Humboldt, and Southern Oregon? Do you happen to know anybody offhand?
I don't know anybody offhand other than perhaps Dr. Sarah Landis. She does pelvic floor PT, and she has her own private practice that she does. There's a neat tool, though. The American Physical Therapy Association has a way that you can look up providers. Of course, those are only providers that are part of the American Physical Therapy Association, and there's a little bit of controversy and drama in that, as all professional associations have. But it is a starting point for people. So not necessarily just looking for pelvic floor, but if you're looking more for telehealth and trying to connect there. And then there's through Herman and Wallace, which is a solely pelvic health focused company. They launched a practitioner search called pelvicrehab.com. And so you can put in state, location, or search by name and see if somebody comes up that way. I'm less familiar with that platform because it is newer. I'm more familiar with the American Physical Therapy Association, but it is difficult, as you say, to find providers in Del Norte and these small rural places. But those are two resources, at least a couple options to have.
Awesome to know. I think I mentioned I have a friend who had a stroke about a year ago, and she's unfortunately in a wheelchair right now, but has potential to walk again, and went to physical therapy in Humboldt County. That I think she only got 3 visits, wasn't very inspiring, wasn't certain on what to do. And I told her about my experience with you, and I said, go back to your provider in the open door system and ask if they have something that's similar. And now she's working with a PhD physical therapists over Zoom, and she has hopes of walking again, like real hopes. And she's doing the exercises, which she was kind of slow to come to that game. But, working out in the pool and everything. And I can't tell you how much it's really going to matter in that particular life. So my question is, somebody in the open door system, if they need physical therapy and telehealth would be a good fit for them, should they bring it up to their provider? Because as a provider in the open door system, I don't hear anybody talking about it, but apparently in Humboldt, it's a thing.
Absolutely.
Yeah.
They should bring it up. Yeah. I think it's a threefold problem. I would say a lot of people aren't aware, in my field at least, what physical therapists even really do.
Yeah,
They either have
that's true.
an outdated understanding where they think it's hot packs and ice packs and ultrasound and, TENS units, which are all very passive, and research indicates, except under very specific, very few circumstances is that appropriate for patients.
Right.
But a lot of people think that's what we do, right? When
Right.
realistically, we shifted away from that a long time ago. It's very exercise-based, very personalized. You can certainly find PTs and clinics that do it the old school way, and I would say avoid those places at all costs. That's not evidence-based practice, you know what I mean? And
Right.
those may be good people, but I would say they're not practicing well. So
Right.
I think that is an issue there. And then, if you don't understand physical therapy at a base, then the concept of telehealth physical therapy, tele-PT, is completely foreign, because how could I put a hot pack on you or do ultrasound virtually? I can't, of course.
Right.
So
Okay.
a lack of understanding there, a lack of providers understanding what physical therapists do, that there is an option for telehealth, what that really means. And then I would say, of course, lack of just access and understanding, where do we find places that do telehealth. So UCSF has been always on the cutting edge of that, where even personally speaking, I did cardiology visits virtually. And of course, that's because it was clinically appropriate. We
Right.
didn't need to do anything in person.
Uh-huh.
And any tests could be ordered, and I could do those in Humboldt County.
Mhm.
But they have a robust telehealth program, and they do telehealth pelvic floor physical therapy and other versions of telehealth physical therapy. And I think, speaking from the open door perspective, that could be a market that could be helpful. And I feel like I hear more and more patients in the open door system referencing, yes, I was told I could go to UCSF, or yes, I advocated for UCSF,
Right.
and then found out through talking to UCSF that there's telehealth options, because they realize that you're driving 5 hours, 6 hours, sometimes more depending on traffic, to get into their system. And so they're pretty good about offering that as well.
Yeah, I'd agree with that. The other thing that's been instrumental with me is you offer kind of homework. What can you tell me about the homework aspect of this? Because I do
Yes.
it almost every day. I do something every day. So.
And that's why I love when patients tell me that. And I would argue that that's ultimately why you're getting better. I love having the honor of being on somebody's journey with them. But I always tell people, I'm really just giving you the information you need and pointing you in a direction. You're only spending an hour with me a week, or sometimes it's twice a week, so it's 2 hours a week. In the grand scheme of things, that's not very much time. You have the rest of the week's worth of hours and life that you're moving through, and different circumstances that you're going through. So the homework aspect really becomes important. I personally try to make that, A, the most applicable to what you're working on and what you want to get back to,
Yeah.
and B, the most entertaining, because not everybody is like myself. I love working out. If it was healthy for me to be in the gym 6 hours a day and there was no consequences, I would love doing that. I just really enjoy being active and using my body that way. But I respect that not everybody does. So
Yeah, I
try
was
to
just
make it.
thinking to myself that I really like Dr. MacGregor until you said you wanted to spend all that time in the gym.
Oh no,
I live a very active
he's
lifestyle.
kind of like a cheerleader. You know,
I try to be. I try to be.
He makes me feel like this is worth doing. And actually, I'll just comment that I do my homework while I'm watching the Olympics. And so I'm like, hey, man, I could be on that podium. You know? So, so you have a special app that's, that I've downloaded onto my phone, and I have. Right now, I think I have like an hour and a half of exercises, but I don't do all of them every day. I do about 45 minutes, depending on.
I was gonna say,
target.
it's gonna paint me as a bad guy. I tell people to choose like 4 to 6, and if they want to do more than that, they can. I try to keep it 20, 30 minutes for people to be realistic.
Okay. But I enjoy it so much. So about 45 is what works for me. And like I said, I'm only minorly distracted by the TV and the dog and, everything else that's going on. But we mentioned before we came on the air, that's one of my selling points when I show my patients. And I do want to say this exercise stuff certainly has helped me with my ankle and my foot postoperatively, but it's also helped me with conditioning and with how I move through the world in my body. And I feel some days I feel like I'm 7 again and I don't have to think about it. So
I love hearing that.
Yeah,
I really do.
I send a lot of people to you to do gait training, and that's part of my evil plan, that they learn how to move through the world in a body that, maybe needed a little bit of help, a little bit of encouragement.
Okay, so I'm gonna jump in here, and I love your guys' conversation, but it's right. I don't have no idea how you would do physical therapy telehealth. So let's take the gait training and just say I need the gait training because I don't have the exercise equipment that a physical therapy office has, right? So it's not even just that I can get ice and I can get a warm pack, but I'm not going to get an exercise bike and a balance ball and these strings and that strings and the TENS units and all of the other things, right? So how would I, Dr. MacGregor, if I were coming to see you for the gait training because Lynn says, hey, you need this, go call Dr. MacGregor and set this up. How would that work if I were going to be your patient and do telehealth physical therapy to get that training without ever having seen you in person?
Good question. So the way that I would work my sessions is it's over Zoom. So I do need to be able to see you. So we need to have some sort of camera situation. I always say that I'm much more portable virtually than I am in real life. So it's easier to move me around and get some nice angles. And that we can really replicate a lot of things via how well I can communicate. Hey, could you put the camera and set it up in such a way that I can see X, Y, and Z? Can you put it at an angle? Can you walk, can you face a certain direction and walk this way and do these sorts of things? So that's kind of the general speaking of how it looks. And it's not always moving things around and getting a ton of different camera angles. It's usually actually just kind of what you would imagine when you look at any other Zoom meetings where it's face to face and we can see each other. They're sitting in a chair, sitting on the couch, and I can kind of see them feet up, that situation.
Okay.
And
so what do they do for like the exercise things that they would need to do? Because nobody's going to go out and buy a home gym just so they can have physical therapy.
Yes. And that's what I tell my patients. You don't need to go out and buy things. I'm a firm believer of not spending money, especially because not everybody has extra money to spend. So I always tell people really what I need is you to be ready to move in clothes that you feel like you can move in. If you want to wear shoes, wear some shoes that you can move in. So not high heels, right? And all I really need is your body and a chair that is sturdy / doesn't have wheels, right? And so that, again, that could be a couch, that could be an ottoman, it could be a chair.
Okay.
But I can make your life very difficult with just your body weight, a chair, using the floor. If you can get up and off the floor safely, my rule is if you can't get yourself off the floor, don't go down there. And that's an across the lifespan thing. We don't need to be calling the fire department or laying on the floor for days.
True story.
And also, really, I've had some patients where I'm like, oh no, we talked about that. Don't do that. The other thing too is canned goods or just random books in your house. If you have a pillowcase or, a backpack, you can empty out a purse and you can put some of those things in there. Boom, you have a pseudo kettlebell or a pseudo dumbbell. And so it doesn't have to cost money. And then the way that we work things in the clinic that I work for, we will send resistance bands via the mail for free. And so that gives some other options too. But I always tell people, you would be amazed at how much I can, quote unquote, beat you up with just your own body weight, a chair, and some canned goods. You know what I mean? So it surprises people. I really enjoy that part. Is I'll show somebody an exercise that looks like nothing. And even when I was learning these things, I was like, what's that going to do for me? And you start doing it, and then you realize, wow, that is really difficult. Wow, I can feel that moving. And it doesn't take a lot. It doesn't take a lot to do that. Sometimes it's being creative with, increasing repetitions and sets versus adding more weight to something, or it's usually you get to use 2 legs for this. Let's have you do it single leg. That makes a big difference. So it's a valid question that people have where they can't conceptualize what it is that we're doing. And so, yeah, getting some more exposure and getting some more information out there, I think, is the next step for telehealth PT. So people understand what it is that they're going to be doing. And we've tried to do that in the clinic that I work for with handouts and brochures and stuff like that. But it takes a while. Marketing campaigns take a while to disseminate information. And I would say the marketing campaign for physical therapy in general is still probably crawling versus walking, and we've been trying to do that for decades. So we need to step it up a little.
Nobody wants to be told that they have to exercise to get better. So is this, because I kind of did some research on you, Dr. MacGregor, before we did this interview, and you no, I'm in love. You're amazing. One of the things that you've got like this quote somewhere, and I can't quite remember it, but you were talking about that you love having to innovate in rural communities to find things to fulfill the needs of the patients. So is that kind of what you do online? Is you innovate and to find things within their home, access things that they have, just the way that you did when you practice locally to help them fulfill their medical needs? So is it just a continuation of that?
It is a continuation of that. It's funny. I really like that you found that because it is something that I really love about rural healthcare specifically. It is the farmer that's 70 years old, and what I need him to do is not get back on his tractor for a week, and I know that's never going to happen. So we find a way to make that. We make it work, and we make it as safe as possible, and that builds good rapport because he expects me to say, you can't be on there. And I always tell people like, hey, you don't know what I'm going to say. And I think we can probably find a way to do it. But finding, not everybody has an ottoman. Not everybody has a couch. Not everybody can get on the floor and do certain things. Limitations wise, you have to be able to think on your feet and to try new things. And everybody's interested in something different. I do Brazilian Jiu-Jitsu, and I'm very passionate about that. And it requires me to put my body in all sorts of weird positions and to be strong. And the injury prevention work that goes into that is very specific and very different from somebody like Lynn, who's like, I want to go hiking. I need to be maneuvering this uneven surface, and I've just had this ankle, foot surgery.
Right.
That looks very different. And how do we simulate that for Lynn in a way that's going to carry over, and I can't just tell her, just take me out on a trail with you right now and we'll just work this out. So it's using pillows, and it's bunching up blankets, and it's trying to dig deep into my thesaurus of exercises, because there's thousands of exercises out there. But what works for Lynn is not going to work for you, Heather. And that's even if you have every possible, if you were identical twins with an identical presentation, you're still going to have individual differences. And I really do love that. Rural healthcare is just so different. I've worked in big cities. I've worked in, big city healthcare, and it's just different. The attitude is different. The personalities are different.
Resources.
And the resources are, they're so different. And I really am thankful that I grew up in a rural area, and I started my practice having to be the person that, a person is coming in, and I'm the first doctor medical professional they've seen in years, and differential diagnosing. Hey, I think you have a tumor. I've done that. Hey, I think you need to go get
Wow.
Wow.
yeah. And it's something that if I don't diagnose that, I can lose my license. Right. So
Right.
that's one of the reasons we went to the doctorate is to have that, primary healthcare provider situation. Because I am seeing that. I am seeing abdominal aortic aneurysms and saying, hey, this is not a me thing. And literally walking people over to the hospital when I was attached to an outpatient clinic that was next to a hospital. Or, I think you've got an internal organ issue going on. I think you've got cholecystitis, and that is what it turned out to be. And I was a student at the time. And so,
Wow.
it's
Rock star.
it is very different
Yeah.
than going to somebody that has, relatively unrestricted access to healthcare, and they go see their doctor 3 times a year, and they do their checkups and all of that.
Okay.
And people
So
are more
you're a
on top of
doctor
it.
who specializes in physical therapy.
Yes,
Yeah, I would say, yeah, like not an MD doctor. I can't do, prescribing and stuff. And the
Right.
military actually is the highest level. So we can order x-rays and, do a variety of things that I can't do on the civilian side. I always say that I'm a movement specialist
Oh,
that
that's
just happens
okay.
to have knowledge in other parts of the healthcare system because I have to, right? Otherwise, I would be misdiagnosing or treating something that I actually am
Would be out
not
of your
clinically
scope.
supposed
Yeah.
to.
Can I
Yeah, out
jump
of my
in
scope.
really quickly? We have 3 more
Absolutely.
minutes. This is exactly what I'd like to know is, I like to give Del Norte kids dreams. How does the average Del Nortean or Humboldtian kid who's thinking they might be interested in this in a career, what's your advice?
Obviously, you need to have the grades for it, right? So try to keep your grades up in high school, and diversify your experience as well with your volunteer and extracurriculars. The standard pitch if you're wanting to go to college. The other thing though is I would get really involved in going around to different settings and trying to get into contact with Sutter Coast, Sutter Hospital, trying to get plugged in with them. Can I shadow a PT? Could I go interview a PT?
Right.
See if you can spin that into, getting credit for a course too, right? Like if you have a work experience or an English course, maybe a little extra credit, you go interview a professional and do a write-up, right? It's always good to get more bang for your buck. But go talk to a variety of physical therapists in different settings, and see what they have to say. Everybody's got their own spin on it. There's controversy within our profession of, is the debt to income ratio worth it? And you can find that in any medical profession for sure. But find out if it is going to provide you what you want. I was lucky and one of the weird ones that figured out what I wanted to do when I was 15, and then literally structured everything school and extracurricular wise to achieve that dream. And I did. And I'm very privileged and lucky to have been able to do that.
Awesome.
But one of the ways that I figured that out too was retesting that theory. Is this something I want to do? Let's talk to this person that has their own business and has been doing this for 20 years. Let's talk to the brand new person that just started and just got out of school. Let's talk to the person in the hospital. Let's talk to the person that works with athletes. Because a lot of people come into it thinking, oh, I'm an athlete, I want to work with athletes. And that's great. And that's a good goal to have. But a lot of people end up finding out that, oh, actually, I really want to go into geriatrics. And I never really thought that. Or I find my position is probably best served in a skilled nursing facility, or it's in an outpatient hospital, system, or it is opening my own practice. So find different opportunities to integrate yourself and to at least talk to professionals. And that can be reaching out, using one of the provider searches that I mentioned on either the American Physical Therapy Association website, or there's all sorts of specialties under that. Finding a provider and just reaching out an email and saying, hey, this is who I am. I'm in high school. I'm thinking about this. What advice do you have? Or what do you think about the profession? Going on Reddit and looking at those message boards. Not everybody's going to want to talk to you, but most of us in physical therapy did something
Love
similar
talking.
to figure it out.
You know,
We figured it out.
We've run out of time, Dr. MacGregor, but you left us on a really inspirational point, and I especially appreciate it for the young people at Del Norton Humboldt that maybe aspire to this.
Yeah, we'll have to bring you back on, and you can talk to our local youth here too about following a medical pathway and then staying back home the way some of our providers have. I thank you very much for being here. I appreciate it, and you have to tell us more about your dogs next time too.
Thank you. Thank you for having me.
Not a problem. Thanks, Dr. MacGregor. This has been a production of KFUG Community Radio. And if you'd like to listen to this episode or any of the episodes of Health Matters with PA Lynn Szabo, you can find those on the KFUG Community Radio YouTube channel. Thank you so much, Dr. MacGregor. Bye-bye.
Thanks.
Thank you.